Hello everyone, welcome back to my YouTube channel Nursing with Beatrice. In today's video, I'll be looking at hypotonic, isotonic and hypertonic solution. So today we'll look at what these solutions means, how to select this solution, the conditions that these solutions are used, contraindications, some side effects to take note of. So let's begin. So before I continue with this topic, I want us to quickly look at some of these terms I've highlighted here. So one is cell. Cell is the basic functional unit of life. We have intracellular, we have extracellular. So the cell itself has both an inside and outside. So the inside part of the cell is called the intracellular. Now the outer part of the cell is called the extracellular compartment. So the fluid present in the intracellular compartment is called intracellular fluid, and fluid present in the extracellular compartment is called extracellular fluid. Then the extracellular compartment, so this one includes the intravascular compartment where we have the blood vessels. We have the interstitial compartment, which is in between the blood vessels. We have the transcellular, where we have the cerebrospinal fluids. Then we look at homeostasis. This one has to do with a state of equilibrium. That's when the body is in a state of balance. Then osmosis. So this is the movement of fluids from a region of lower concentration of solute to a region of higher concentration of solute through a semi-permeable membrane. Some of these membrane can be cell membrane. It can also be capillary walls. Then this solute we're talking about, mostly it can be sodium salt. It can also be glucose. So look at this diagram I've drawn here. So let's assume this to be a cell. So inside of this cell is the fluid. So there are fluids inside the cell. There are also electrolytes inside the cell. Then the extracellular compartment, these small dots are water molecules. You can see the outside of the cell is the extracellular compartment where we have extracellular fluids. This here too, it has solute in them. It has electrolyte. So now, but they have to be a balance so that there will be no fluid shift. So in other words, this extracellular compartment has the intravascular, it has the interstitial, even transcellular. They are all part of the extracellular compartment. So now quickly, let's look at hypotonic solution. So hypotonic solution, the word hypotonic. Hypo has to do with lower concentration. Tonic is concentration. So lower concentration of a solution. So it means when a solution has a lower concentration in the extracellular fluid, more than the intracellular fluids. So we call that hypotonic solution. So look at this diagram here. So let's say this is the cell. Now, inside of the cell, there are more solutes. Outside of the cell, there are less solute. Let's take a solute, for example, salt. So if we have more salt inside the cell than outside the cell, osmosis will happen. So fluid will move because the hypotonic solution, after you've given it to a patient, is coming into the what? Extracellular compartment. But because it's hypo, is lower in concentration than inside the cell, there will be a shift, there will be osmosis through the semi-permeable membrane. Water will move from the region of this lower concentration where the hypotonic solution is to a region of higher concentration which is inside the cell. So because of that, the more the fluid moves, let's say the water molecules move, notice it here, the water molecules have decreased. If you here we have like I think up to 8 dots that I just used in representing it, but here it's just like about 4. Other ones have moved into the cell. So the more it moves in, the cell swells up. So meaning the cell can swell up and even burst. So the best way to remember this, when you say hypotonic, think of something hypoactive. When you are not active, you are likely going to what? Big, you'll get obese. So that's how I think you can remember this. So based on what we've explained, so we look at the side effect. For when you give a patient a hypotonic solution, the cell will likely, if it becomes too much, the cell can swell, the cell can rupture, what we call lysis. And then the side effect again can lead to what we call hypovolemia. Because the fluid is moving from the extracellular to the intracellular, meaning there's depletion of even interstitial volume, there's depletion of intravascular volume. It will get to a point that there may be low volume of fluid in the blood, so what we call hypovolemia, meaning there will be depletion of circulatory volume. Another side effect can be hypotension. Again, look at it this way. So when you give hypotonic solution, there's going to be a shift of fluid because inside the cell is more concentrated. Fluid will move out of the intravascular space, and with time it's going to decrease the intravascular volume, which can lead to hypotension. And this can also cause cerebral edema because as the cell begins to swell, it can go to the transcellular, it can enter the cerebrospinal fluid and increase the cerebrospinal fluid. It can cause the cerebrum to swell up, so leading to what we call cerebral edema. So examples of hypotonic solution. So use normal saline as a baseline, which is 0.9% normal saline. That is isotonic. I'll look at it shortly. Anything less than that, isotonic, meaning anything less than 0.9% normal saline can be examples of hypotonic solution. Look at it this way, because normal saline is iso, is the normal level, so half of it will be hypotonic solution. Another one is 1/3, so 1/2, 1/3 normal saline, which is 0.33% saline, is hypotonic solution. 1/4, when you divide it into 4 in terms of concentration of normal saline, which is 0.225 saline, is also hypotonic solution. Then D5W. So this one, D5W, I will also mention when we get to isotonic solution because it's both. Note that 5% dextrose in water is hypotonic when it has been metabolized, or inside the body it becomes hypotonic because the body will use up the glucose as soon as possible, and then what we are left with is just water, meaning we are already down to hypotonic solution. So let's look at the condition where we can use hypotonic solution. So in cases like hypernatremia, picture it where there is so much sodium in the blood, so you want to dilute it. Think of when you are preparing a pot of soup and you notice that the soup, there's so much salt in it. One way to dilute the soup is to add water. When you add water, the soup will feel less salty. So think of it that way. So when there's hypernatremia, high sodium in the blood, when you give hypotonic solution, it dilutes it. So that's one. Another one is in HHNS, even in DKA. So in HHNS and DKA, they are so dehydrated to a point that their cell is starved. There's cellular dehydration. So when you give hypotonic solution, it moves into the cell to expand or to increase the cell size, to kind of hydrate. So we use hypotonic solution to hydrate the cell. So these are some of the conditions. Now, contraindication, or where we should use it with caution. So in cerebral edema, they already have a lot of fluids accumulating there. You don't want to use hypotonic solution there because it will worsen it. Then another one, in increased intracranial pressure. Of course, from cerebral edema, you can have increased intracranial pressure, meaning there's so much fluid also accumulating in the cerebrospinal space. So because of that, you don't want to give hypotonic solution so that it doesn't worsen it. In burns and in trauma. So for burns, already they are hypovolemic. Even in trauma too, they've lost so much fluid or blood, they are already hypovolemic. So you don't want to be giving hypotonic solution to them, because if you give it to them, it can worsen it. It will lead to more hypovolemia because of fluid shift from the intravascular into the intracellular. If you are enjoying this video, please hit the subscribe button. Thanks. So isotonic solution. So as the word goes, isotonic, equal in concentration. So it's just like when you are perfect. There's no issue with shifting of fluid from one compartment to another. So think of somebody that has a good shape. They are not looking for how to reduce weight or to add weight. So that's like isotonic. So look at this diagram here. So this is the extracellular compartment, this is the intracellular. So they have equal number of solutes. Because of that, there is no shift of fluid from one compartment to the other. So examples. The first one is 0.9% normal saline. Remember when I was talking about hypotonic solution, I asked you to picture 0.9% normal saline as the baseline. When there's any solution below 0.9%, we're looking at hypotonic solution. Above 0.9% normal saline, we're looking at hypertonic solution. So meaning 0.9% normal saline is isotonic, it's at the middle. There's not going to be a shift of fluid from one compartment to another. Another one is lactated Ringer's solution. And then we have D5W. Remember, when I was also talking about hypotonic solution, I told you that D5W can be both isotonic and hypotonic. Hypotonic when it's already metabolized in the body. Why isotonic? When it's yet to be metabolized, maybe at the point of administration, it is isotonic solution. Then indication. So the condition where we use isotonic solution, in fact, this is the most commonly used solution. One is surgery. So during surgical procedure, they can prescribe isotonic solution in hemorrhage or bleeding. When somebody have lost so much blood, there's decrease in intravascular volume. So we give isotonic solution to hydrate and keep that intravascular volume expanded. So the fluid is not going to shift from the intravascular to any other compartment. It stays there. So that's one good indication. And once you do that, the blood pressure will come up, because the blood pressure may be low when the person has bled so much. But once you give him fluid, because plasma is lost, but when you give him fluid, you are increasing the intravascular volume, the plasma volume increases, and the blood pressure can be normalized. In dehydration, so whenever somebody is dehydrated, maybe from vomiting, from diarrhea, even from excessive sweating, you want to give isotonic solution to expand the extracellular compartment and keep it stable. So now I want you to take note of some points based on some solutions here. Normal saline, this is the only one we use in blood transfusion, whether before blood transfusion, during blood transfusion, maybe you notice a reaction, even after blood transfusion. Normal saline is the only one compatible with blood transfusion, no other solution. Then lactated ringer solution. So note that this one, though we know it's isotonic solution, but not because it contains electrolytes, it contains potassium, it contains calcium, it contains sodium, even it contains lactate. Because of that, we do not give it to patients that have kidney diseases. Because of what? Potassium. That potassium, patient with kidney disease, they find it difficult to excrete potassium. So because of that, if you give them lactated ringer solution, you are going to worsen the potassium. There will be hyperkalemia, and that will cause cardiac arrhythmia. So to avoid that, the best solution for them may be normal saline instead of lactated ringer solution. So take note of that. So side effect of isotonic solution, though we say it's kind of perfect, it's the best and all that, but note that anything that is excess, when you do something excess without taking caution, you can have side effect. And as nurses, we're always careful with anything we are doing. Even if they say the thing does not have any issue, we also want to play with caution, want to do our job with caution as nurses. So because of that, we need to also watch out for some things like hypervolemia. Imagine a patient is dehydrated, you are giving IV fluid. You still need to control, you need to monitor, you need to listen to the lung sound to be sure that you are not loading them too much. Because as you are giving isotonic solution, it's going to expand the intravascular volume. But if you keep loading and loading, they can go into hypervolemia, where there will be too much fluid in the blood. So you want to ensure that you watch out for that. So that means too, you are watching out for fluid overload, even pulmonary edema. It can also be a side effect of isotonic solution. Let's look at hypertonic solution. So hyper, we have left the state of balance, or a state of normal. So we're not going to above that normal saline. I want you to picture it that way so you don't forget. So when it is above 0.9% normal saline, we're looking at hypertonic solution. Or when there's too much glucose in the water, we're looking at hypertonic solution. So meaning it's a solution that has more concentration in the extracellular compartment than in the intracellular compartment. What do I mean? When you are giving a patient a hypertonic solution, of course, any fluid you are giving first goes into the extracellular before it decides whether it's going to stay in the extracellular or it's going to move in. So if you give a patient a hypertonic solution, when it gets to the extracellular, it means the extracellular is more concentrated. Meaning the fluid in the intracellular compartment will sense it that the outside environment of the cell is more concentrated. Through osmosis, fluid will move from inside the cell to the outside the cell. So look at this diagram here too. So picture this as the cell. Outside the cell, there are water molecules. So picture this as the cell. Outside the cell, which is the extracellular compartment, we have water molecules. Inside the cell, we also have water molecules. Now, outside the cell, we are saying that there is more solute. So there is more solute because of hypertonic solution. What will happen? There is less solute here. So the water here will move through osmosis. It will begin to flow into this compartment. It will move into the extracellular compartment, and with time, most of the water molecule will enter the extracellular compartment, making the intracellular compartment to shrink. So if you look at this will result to this. If you look at this diagram now, look at the extracellular compartment, so more fluid. So you see some of the fluid has reduced. Now we're having just an illustration, having like just one water molecule left in, meaning this cell has shrunk. You see the size of the intracellular has reduced to this, because with time, as fluid keep going out, it will shrink the intracellular compartment. So there will be what we call cell shrinkage. So let's look at the examples. So anything higher than 0.9% normal saline, or the one that contains high glucose, we are looking at hypertonic solution. So examples include 3% saline. Already 3% is higher than 0.9%. 5% saline is higher. Now 5% dextrose saline is higher, because this one you are talking of mixture of both dextrose and saline salt. 5% dextrose in lactated ring gas. So this is also higher, because you are combining two, and not just combining, you are seeing 5% dextrose in lactated ring gas. Then we have 10% dextrose water, so much dextrose in water. 20% dextrose water. These are all hypertonic solution. 5% in 0.5% normal saline is still going to be hypertonic solution. So you don't really need to cram this. If you know that 0.9% normal saline is like the baseline, is isotonic, lactated ring gas is isotonic, 5% dextrose water, when it's just being administered or still in the bag, is isotonic solution. Above that will become hypertonic. So that is how you'll be able to remember. Below that will become hypotonic. So anything lower than 0.9% will be hypotonic. Even lower than 5% dextrose water, like 2.5% dextrose water, will be hypotonic. So with that, you'll be able to picture, and when you sit in exam, you can easily pick it. Now, indication. So where do we use this? One is hyponatremia. Look at it again. Where there's low sodium in the blood. It's just like you are looking at your soup you've just made. There's not enough salt. So you want to give something to increase that salt. So you can give hypertonic solution. So that's just like an illustration. When there's low sodium in the blood, they may prescribe hypertonic solution. That is if isotonic solution is not really able to replace the sodium as soon as possible. So they may give hypertonic solution. In cerebral edema, there's accumulation of fluid. So when you give a hypertonic solution, you want to shrink the cell to pull out some of those fluids out. In hypovolemia, so hypovolemia meaning there's low blood volume. So when you give a hypertonic solution, as it goes into the intravascular space, it's going to pull fluid out from the interstitial, from the intracellular. It pulls it into the intravascular, and with that, the hypovolemia can be resolved. Now, contraindication, or where we should use it with caution, in heart failure, in renal failure, it's advisable you use hypertonic solution with caution, or if possible, don't use it at all. They don't normally prescribe it in situations like this. Isotonic solution will be better for heart failure and renal failure. So side effect, number one will be cell shrinkage. That's because of that pool of fluid, because the hypertonic solution is going to pull fluid out of the intracellular. The cell will shrink with time, which is what I've explained with that illustration, that diagram. Then hypernatremia. Picture your soup that you are cooking and you feel there's not enough salt, and you decide to give more salt. If you put too much, it can become hyper, right? So the food will become too salty. So if there's hyponatremia and you are not giving hypertonic solution, you do it with caution. You don't want to give too much and then sodium become too much again. Anything too much in the body is not good. The body wants to be in a state of homeostasis, balance, so that the body can function properly. Hypervolemia. These are some of the side effects. So that wraps up today's topic on hypotonic solution, hypertonic solution, and isotonic solution. If you find this video helpful, please like, share, and subscribe for more educational content. Thanks for watching.